Imagine a virus so deadly it can turn a healthy person into a critically ill patient in days. That's Ebola. In May 2026, the World Health Organization declared a new outbreak in Central Africa, a public health emergency of international concern. Today we're breaking down what Ebola is, how it spreads, the symptoms, treatment options, risks, and how to protect yourself. Ebola, or Ebola virus disease, is a severe and often fatal illness caused by viruses in the orthobolavovirus genus. There are several species, including Zaire Ebola virus, the most well-known and deadliest, and Bundibugyo virus, which is behind the current 2026 outbreak in the Democratic Republic of the Congo and Uganda. It was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of the Congo. Ebola is a zoonotic disease, meaning it jumps from animals to humans. Fruit bats are believed to be the natural reservoir. Without treatment, case fatality rates can reach 25 to 90%, averaging around 50%. With good supportive care, survival improves significantly. Ebola is not airborne like COVID or the flu. It spreads through direct contact with the bodily fluids of infected people or animals. Key transmission routes include blood, vomit, diarrhea, saliva, sweat, semen, breast milk or other fluids from sick or deceased people, touching contaminated surfaces, needles, or medical equipment, handling or eating bushmeat, and funerals or burial rituals involving close contact with the body. Importantly, people are not contagious before symptoms appear. The incubation period can be 2 to 21 days. Once symptoms start, the virus multiplies rapidly and becomes highly infectious. In the current Bundibugyo outbreak, cases have spread in health facilities due to poor infection control, and there have been imported cases into Uganda. Early symptoms mimic the flu: sudden fever, fatigue, headache, muscle pain, sore throat. Then it progresses to vomiting and severe diarrhea, causing dehydration, abdominal pain and rash, impaired liver and kidney function, in severe cases, internal and external bleeding, confusion, shock, and multi-organ failure. This is why it's called a viral hemorrhagic fever. Symptoms usually appear within 8 to 10 days of exposure. There's no one-size-fits-all cure, but progress has been made. For Zaire strain outbreaks, monoclonal antibody treatments like Inmazeb or Ebanga significantly improve survival when given early. For the current Bundibugyo strain in 2026, there are no approved specific vaccines or therapeutics yet. Treatment focuses on supportive care, aggressive fluid and electrolyte replacement, oxygen therapy, pain management, and treating secondary infections. Early medical care in specialized isolation units dramatically boosts survival rates. Vaccines like Ervebo exist for Zaire Ebola virus and are used for high-risk groups, healthcare workers, outbreak responders. Risk is highest in outbreak zones in sub-Saharan Africa, especially for healthcare workers, family caregivers, and those involved in unsafe burials. Globally, risk remains very low for most people, including travelers outside affected areas. The US and Europe have implemented enhanced screening for travelers from outbreak zones. Avoid direct contact with sick individuals or their fluids, and use strict infection control, PPE, in healthcare settings. Practice safe burial practices. Avoid bushmeat in endemic areas. Get vaccinated if you're a high-risk responder. Wash hands frequently and follow public health guidelines. Ebola does not spread easily through casual contact like sitting next to someone. Ebola is frightening, but knowledge and rapid response save lives. If you develop fever or symptoms after travel to affected areas, seek medical care immediately and mention your travel history. Stay informed through reliable sources like WHO and CDC. Share this video to spread facts, not fear. Thanks for watching our Health Pinpoint breakdown. Always to the point, the pinpoint.